You don't feel well, you usually want your doctor to give you something to make you feel better, right? Well, now the state may allow doctors to figure out if you're seeing more than one of them. More specifically, they want to make sure you're not trying to double or triple up on prescriptions. ABC 2 News' Don Harrison explains that two lawmakers are at odds over this issue, even within their own party.
Prescription drug abuse is a national problem, one that's having a big impact on Maryland. That's why Delegate Dan Morheim is behind a bill that will force pharmacies to monitor and keep track of who receives specific prescription drugs. This will allow doctors or other medical facilities to see that if a patient has been prescribed a particular drug before. That goal is to curb doctor shopping when someone tries to get several prescriptions of the same drug from different doctors.
We want to get a handle on it in a way that maintains the doctor-patient relationship, maintains appropriate drug use for those who need it, people in serious pain, and at the same time allows information to be made available.
Supporters say the program will not use Maryland tax dollars.
The funding comes from federal grants. There are no fees being attached to prescribers, physicians, nurse practitioners, dentists, or dispensers, meaning pharmacists.
Are you really getting accurate information?
Delegate Ted Sophocles has been a pharmacist for the last 46 years and has some concerns with this bill. First and foremost, privacy.
Well, I think a liability question is a problem right away, and how they're going to keep the record, how they're going to monitor it, who's going to monitor it, what's going to be their responsibility. I think that's really not defined that well in the bill.
Maryland is one of 5 other states and Washington, D.C. that does not have a prescription drug monitoring system in place. The bill passed unanimously in the Senate and now is up for debate here in the House. In Annapolis, I'm Don Harrison for ABC 2 News.
And state public health officials say there's been a 250% increase in poison control calls related to the drug oxycodone from 2007 to 2010.